Hey guys, so this video we're going to talk about medium and large cell vasculitis. So first of all, what is vasculitis? Basically, it's just inflammation of the arteries somewhere in the body, and they're designated into three categories: large, medium, and small. So the small ones we'll do in a different video, but for now let's go through these. So for large vessel vasculitis, there are two of them, and the first one we're going to talk about is called temporal or giant cell arteritis. And so you'll see that a lot of these kind of have similar features like fever, maybe a headache, some pain, visual problems, but each vasculitis will have its own key factor that what it'll allow you to discriminate between what makes it temporal arteritis or what makes it Takayasu arteritis, and we're going to talk about all that. So starting with temporal arteritis. Uh, It's called temporal arteritis because it affects the temporal artery, right? And so I want you to kind of think of this picture every time you think of temporal or giant cell arteritis and think giant because when you have pain in your temporal artery, it'll give you a giant headache. And headache is one of the very common symptoms associated with this. And it's most commonly seen with older adult women. And in addition to the headache, you'll have visual problems and often pain with chewing and even flu-like symptoms. And so you can see how, it'll start, maybe you have some pain here, and then she'll say, "Oh, I was eating something earlier, and the pain kind of radiated, and that hurt." And she's having visual problems because it's, they're connected to the ophthalmic artery. And so some findings are increased ESR and granulomatous inflammation. So again, there's a lot of inflammation and a lot of pain. Basically, so that's the main those main findings there, and it has some association with polymyalgia rheumatica. So if that is if you see that, that could be a tip off that it's temporal arteritis and not the other ones. So the treatment for this is going to be corticosteroids, and you'll see that corticosteroids are a treatment for a lot of these vasculitis conditions. And so without treatment, you'll have high risk of blindness because the arteries get occluded with the inflammation and the granulomas that are forming. And so you'll have, occlusion of the, this is the facial artery, but you'll have occlusion of the ophthalmic artery. And if you don't treat that, then, the patient will have blindness. And so that's also very important. So if the, if patient comes in with visual problems and it's only getting worse and there's a headache, jaw pain, older woman, temporal artery, temporal giant cell arteritis. Okay, next one is Takayasu arteritis. And this one is known as the pulseless disease because there's like a weak or absent pulse in the upper extremity. And this is common in adults, usually Asian women that are, younger than 50, not too old. And you'll see, weak or absent pulse, specifically in the upper extremity sometimes, and mostly non-specific symptoms. Maybe skin nodules might be more specific, but you see like ocular disturbances, like that could be, giant cell arteritis. If you're just looking at the fever and the myalgia. So make sure to look for something like a weak or absent pulse in an Asian woman. And again, increased ESR and granulomatous inflammation. And this is more in the proximal vessels of the aortic arch, and so that's why I included that picture up here for you. And so these are just the nodules that you could see on the skin. And again, we would treat this with corticosteroids. Okay, so now let's talk about the three medium vessel vasculitis or vasculitides. So the first one is Berger disease, and this is my favorite one to remember because I have a good image for you guys. So this one is more common with heavy smokers and in males. And so smokers is going to be a very key kind of mnemonic or a key way to remember this, okay? And so it's also called thromboangiitis obliterans, which is also helpful, as you'll see. So the symptoms of this is you'll have thrombosis with the veins and mostly in your fingers and toes. And so without the blood flow, you'll have ulceration and necrosis and gangrene formation, and you'll lose your toes and your fingers, towards the tips. And so again, commonly fingers and toes, heavy smokers, yeah. And so this is very common in Raynaud phenomenon. So if you know what Raynaud phenomenon is you'll have random spasms of the blood vessels in your fingers, causing them to collapse, and you'll lose blood flow to the fingers, and so they'll be all white. But again, this is also associated with smoking, heavy smoking. And so the picture I have for this is this. So this is a burger, and because it's Berger disease, and as you can see, you have these fingers that are necrotic with gangrene coming out of the burger. So imagine eating a burger with fingers coming out, and then I added smoke to their, it's from heavy smokers. And so I thought of this once, and I never forgot it, and it really stuck with me and helped me remember what Berger disease was, because the obliterans, the thrombo meaning thrombus, and obliterans meaning loss of blood flow because of the thrombus, right? And so that's why you have these necrotic fingers. And so treatment, just stop smoking, really. And then sometimes they'll have to amputate the fingers if the necrosis has gone too far. So Kawasaki disease is specific to Asian children usually that are less than 4 years old, which is pretty high yield. And you'll have some non-specific symptoms like rash, fever, conjunctivitis, lymphadenopathy, erythema. And then there are more specific findings. So like the strawberry tongue and the red lips is very specific for this. And then cardiac aneurysm is also very specific. And so these are kind of, these are light bulbs. Every time you see that, that's what you should be thinking about is Kawasaki disease. So the coronary artery is what's involved. And so you have thrombosis within the coronary artery, leading to an MI. And, an aneurysm rupture can cause death with specifically with the coronary artery. And so the treatment for this is aspirin and immunoglobulins. And aspirin is very high yield here. Make sure to know that. Okay, and then the last one is polyarteritis nodosa. And so we're going to use the name again to help us remember what the disease is, where it is, and what's involved. So poly meaning many, and then nodosa meaning nodes, and then arteritis. Okay, so it's most common in young adults. And, again, non-specific symptoms, these aren't as, it's kind of hard to tell with just those. And so more specific findings it's a necrotizing vasculitis, usually with most organs like the kidney, but very important, it doesn't affect the lungs or the pulmonary arteries and veins. And so it's also associated with hepatitis B. I believe the positive surface antigen to hepatitis B. So look out for that. And again, this is fibrinoid necrosis. So that's a transmural, meaning the entire artery, the entire width of the artery is involved. And over time, that can, that weakens the artery wall. It can cause aneurysm formation. And you'll have aneurysm formation and dense fibrosis along with it. And so these aneurysms plus the dense fibrosis is what causes these nodes. And as you can see here, what these arrows are pointing to is all these little balls, these little nodules here. and that's called the string of pearls or rosary sign. And so you can see all throughout, right? So that's why it's poly, meaning many, and then nodosa, meaning nodes. So just many nodes. And again, this is a medium vessel vasculitis, and that's why it's affecting the renal artery and affecting the kidneys and other medium vessels throughout the body. And so the treatment for this, again, is corticosteroids, and for this one specifically, cyclophosphamide, but corticosteroids is, most important. And that's it. So I hope that was helpful, and let me know if you have any questions. And yeah, thanks.